Hey guys, and welcome back to Little U Life. I'm Dr. Gibson Gray, and we've got a really important topic that we'll be discussing today. We're going to be taking a look at necrotizing enterocolitis, or NEC for short, a life-altering complication of prematurity that every NICU parent should be made aware of. NEC stands for Necrotizing Enterocolitis. This is a serious condition that is almost exclusive to premature babies and happens when part or all of a baby's intestines become sick or die. A baby with NEC is very sick, and when they get sick very fast. It usually starts with mild impaired digestion, so maybe some leftover milk in their belly after a feed. This is called residuals. Then there's abdominal distension and maybe even some vomiting. When I see a baby with NEC, they have a very poor color, a dusky gray color, an extremely decreased activity level. They don't feel good at all, and it shows. They may even have some bloody stools. Then when we look at their labs, we see some very characteristic trends, like extremes of blood sugar, both high and low, abnormal electrolytes like sodium and potassium, and even some low platelets. We may also see a rapid change in their acid-base balance we call metabolic acidosis. So once we suspect NEC, we'll get an X-ray to look for any changes we see to their intestines. And we may see some very specific findings on those X-rays. Pneumatosis is the hallmark of NEC and is caused by air within the wall of the intestine. What makes this somewhat difficult to determine is that pneumatosis sometimes looks similar to stool or poop on an X-ray. Obviously, one is very bad and the other is very normal. So, we also may see something called portovenous gas, or air in the blood vessels that go through the liver. This is also diagnostic of NEC. And last, we'll probably notice some very enlarged intestinal size. This is because anytime bowel gets sick, it gets stunned and frozen scared and stops moving, and it leads to a buildup of air and food in that bowel. And if that tissue gets sick enough, it will start to bleed, leading to bloody stools, and maybe even so bad that a hole in the bowel wall develops. And so if this happens, the baby will need surgery, but we'll cover that in a moment. There's not likely one singular cause of NEC, and we can't predict exactly which babies will have it. However, we are beginning to understand which babies are at the highest risk of NEC. NEC is most common in preemies that are being fed, and we know that using breast milk decreases that risk over formula. Some hospitals even offer donor breast milk, which has been shown to lower the risk of NEC, but it is not preferred over mom's milk because of the processing it has to go through. Some other things that likely increase the risk of NEC, like infection and low blood pressure. There's even some evidence of NEC that happens after some blood transfusions, but that is unclear if it's actually the transfusion or the preceding anemia that actually causes NEC, since dying tissue is usually more likely to happen when oxygen delivery is lower due to a lower blood volume. There's only a few things that have been proven effective with actual evidence to decrease NEC rates in preemies. As we mentioned before, breast milk. We know that NEC happens to babies that are being fed. But breast milk, mom's breast milk, is safer than formula. Some hospitals even offer donor breast milk if mom isn't able to provide enough milk, but not all hospitals have this available. Probiotics have been shown to lower NEC rates. What are probiotics? Probiotics are the good bacteria that we have in our gut, and when babies are born, sometimes they don't have that good bacteria, so probiotics can help change the flora of the baby and add some of that good bacteria back into the intestine so the bad bacteria don't take over.
The FDA recently removed probiotics from the market due to what many in the neonatology community believe to be a tragic overreaction to an unfortunate event. A single case of death was reported as a result of probiotic bacteria in a premature baby. While any death is tragic, our decisions must be based on a larger view of risk versus benefit. The decision from the FDA reacting to this single case is now putting potentially thousands of babies at risk for NEC and death. The data supporting probiotics remains in favor of its use despite this decision.
And lastly, we want to prevent things like infections, any acid buildup in the blood, and anything that will decrease blood flow to the intestines, like low blood pressure or even a PDA. Don't know what a PDA is? Check out our previous video to learn about that. NEC is treated with antibiotics and by letting the intestines rest from digestion for a little over a week. In the meantime, babies will receive nutrition by IV, sometimes called TPN. We also want to be on the lookout for any signs that a hole is developed in the intestines, because if this happens, the baby will need to have surgery. If a baby needs to have surgery for neck, this is done in one of two ways usually, determined by the surgeon. They may decide to place a small drain into the abdomen to allow any excess fluid or pressure to be relieved while the intestines heal. Sometimes an open surgery is needed to remove a portion of the intestines that are dead. If this is needed, then the remaining ends are either reconnected immediately or one end is brought up to the surface into something called an ostomy. This is temporary and allows the other end to heal before reconnecting it at a later time. If a baby loses a significant length of intestine, then they may have a difficult time absorbing the necessary nutrients from their food. When this happens, this is called short gut syndrome. Expectedly, this can be a long recovery period and cause many challenges to growth and development. Unfortunately, there are some long-term complications that neck can cause. After the intestines have healed, they can form what's called a stricture. Anytime a tissue heals and forms a scar, that scar can pull on the surrounding tissue. This is no big deal when it comes to things like little knee scrapes or even a small surgical incision. But when that injury involves a tube, and intestines are a tube, then that scar tissue that forms can cause a narrowing to that tube. If this happens, it can lead to an obstruction where food can't move past that narrow point. There's also a significantly increased risk of neurologic impairment, repeated surgeries, and even a need for tube feeding in any survivors of neck, all of that measured at 18 to 24 months. Neck is a very scary condition for everyone, and it's a hard diagnosis to receive as a parent because it is such a life-changing event. Overall, neck affects 3 to 9% of premature babies less than 37 weeks and carries a more than 23% mortality rate, which can be up to 50% mortality if surgery is required. Neck is the single leading cause of death in extremely premature infants before 2 months of age. About 500 babies per year die from neck in the United States. In the world of neonatology, a lot of effort is made to prevent neck and lower the overall rate of this condition. However, even though we've made a lot of progress in the last few decades, we still have a long way to go. It's extremely important for any parent of a NICU baby to be aware of this potential complication of prematurity and its lasting effect on babies, even long after they go home. And finally, we want to underscore the importance of breast milk in all babies. But preventing neck is the single most important reason we believe that all premature babies should receive only breast milk feeds. If your hospital offers donor breast milk, we strongly recommend its use for your premature baby. Thanks for watching. Don't forget to check us out online at Little U Life and share this video. Comment below to tell us about the little you in your life. We'll see you next time.